Hey there, I'm Dr. Hannah McLeod, and I've been practicing medicine here in Canada for over 30 years now. Today, I want to have an honest conversation with you about something most folks don't talk about openly, but it affects millions of men across the country. Let me ask you something. How many of you have noticed changes in your body after hitting 60? Maybe things don't work quite the same as they did 20 or 30 years ago, eh? Well, you're not alone, and here's the thing. Your penis goes through changes too. And honestly, that's nothing to be embarrassed about. It's just part of life's journey. So let's get right into it. The first thing you'll probably notice is that the tissue down there becomes less elastic over time. This happens everywhere in your body, not just there. Your muscles lose some of their tone, the skin gets thinner. It's completely natural. What this means practically is that erections might not be as firm or as quick to happen as they used to be. Now, here's the science bit. After 60, blood flow isn't as efficient as it was when you were younger. The blood that fills those chambers during arousal just doesn't pump with the same force. Add to that something called arteriosclerosis, where your blood vessel walls get stiffer and you can see why things slow down a bit. I'll be straight with you. Studies show that somewhere between 40 and 70% of men over 60 experience some form of erectile dysfunction. But here's what I tell my patients every single day. This is not a life sentence. There's plenty you can do about it. First off, Kegel exercises. Yes, they're not just for women. Strengthening your pelvic floor muscles can make a real difference. Try squeezing those muscles you'd use to stop urinating. Hold for 5 seconds, release. Do this 10 times, 3 times a day. Give it a couple months and you'll likely notice improvement. Second, watch what you eat. Foods that are good for your heart are good for your erections. Think salmon, blueberries, leafy greens, and yes, dark chocolate in moderation. Cut back on the processed stuff and try to keep active. Even a 20-minute walk around the neighborhood helps with circulation. Now, testosterone. After 40, your levels start dropping gradually, and after 60, that decline becomes more noticeable. You might feel less desire, and that's okay. It doesn't mean your intimate life is over. It just means it changes. Many of my patients tell me that intimacy at this age becomes deeper, more emotional, less about performance, and more about connection. Something else that happens is reduced sensitivity. The nerve endings down there aren't as responsive as they used to be. Reaching climax might take longer or feel different. This can be frustrating at first, but with patience and good communication with your partner, you can adapt and still enjoy a satisfying, intimate life. And speaking of communication, please talk to your partner about this. I can't stress this enough. Many men feel ashamed or think they're losing their masculinity. But these changes don't define you as a man. Opening up actually strengthens your relationship. Here's when you should come see someone like me. If you're having persistent problems, if there's pain, or if you notice any unusual changes, don't tough it out. We're here to help, not to judge. Look, getting older isn't a punishment. It's a new chapter. Your body is changing, sure, but that doesn't mean the good times are behind you. With a bit of knowledge, some lifestyle adjustments, and honest conversations, you can absolutely maintain a fulfilling, intimate life well into your golden years. Take care of yourselves, folks. And remember, there's no shame in asking for help.